Hi, my name is Ratinder Kaur and I am in class BSN 346 and I am making this video about prenatal education. So in pregnancy, the primary visits are important to check for mother and the fetal condition, and they are done every 4 weeks from week 14 to week 28, and then they are done from week 28 to week 35 every 2 weeks, and then they are done from week 36 to the birth. They are done every weekly, once a week. So in those appointments, the doctor will check for vitals, will check for urine for protein and glucose. The doctor will check for weight gain. The doctor will check for fundal height, fetal heart tones via Doppler. They will also check for swelling, any infections, any discomforts that a mother might have throughout the pregnancy. These initial visits are important to keep track with your pregnancy, to see if everything is going okay. The testing and procedure that is done during the pregnancy is blood type, antibodies, RH type, urinalysis, a glucose test, group B streptococcus, which is GSB, ultrasounds. I know there's one more. A pap smear and STI screening. All of these tests are done to detect if the patient has anemia, if the patient is RH type, incompatibility, to detect any UTIs, any infections, any STI infections. Ultrasounds are done to see, they are done initially as well to prove the pregnancy as well, to see if it's positive, and then they are done at the 18 to 20 week at mark of pregnancy to an anatomy scan. It is done for an anatomy scan. All of these testing is important. A glucose test is done to see if the patient has any gestational diabetes. And then the patient is allowed to have exercise. They can do moderate exercise. They can do walking, swimming, aerobic activities. They can do yoga. What they're not allowed to do is doing a heavy lifting, any type of exercise that could be contact support, like something that they could actually fall easily and hurt themselves. And the nutrition that is very, very important during pregnancy is prenatal vitamins, iron supplement, folate, vitamin vitamin B12, and sorry, I'm going blank right now. DHA is important. Folic acid is important, because it prevents neural tube defect. Iron is important for anemia, which is all gained through leafy greens and legumes, spinach, Calcium is important for the bones, for the fetal strength in the bones, and the weight gain throughout the pregnancy is recommended to be 1 pound gain from second trimester to third trimester. Weight gain should be a gradual weight gain of 1 pound, which is the normal weight gain is about 25 to 30 pounds. The BMI, the normal BMI is 18.4 to 24.5, and anything above that to up to 29.9, it is overweight, and anything above the BMI of 30 is considered obese. The patient usually have the three most common complaints is nausea, vomiting, heartburn, and back pain. Nausea, vomiting could be relieved by eating small meals. Heartburn could be relieved by eating small meals and sitting upright after eating. Nausea, vomiting, avoid like strong odors. And then backache could be avoided, could be relieved by doing some pelvic tilt exercises. And the three common complications that could be vaginal bleeding, severe headache, swelling of the face and hands, and no fetal movement, which could indicate miscarriage. It could indicate ruptured membranes. It could indicate an early fetal demise. Swelling of the face and severe headaches and vision changes, that could be indicating preeclampsia, which is hypertension. I think that's about it. Thank you.